This is case study 10. MR, 36-year-old certified registered nurse anesthetist, was diagnosed 7 years ago with a latex allergy. She first noticed that she developed contact dermatitis when she wore powdered latex gloves. She soon developed tachycardia, hypotension, bronchospasm, urticaria, and rhinitis with contact or proximity to latex in surgery. She had one frightening episode of anaphylaxis, and her allergy is of the type 1 hypersensitivity IgE T-cell mediated latex allergy, which was diagnosed by both a radioallergosorbent test and a skin prick test. MR avoids all contact with any natural rubber latex in her home and at work. She can only work in a pediatric OR because they are latex-free. Since many children with congenital disorders are latex allergic, she wears a medical alert bracelet and uses a bronchodilator inhaler at the first symptom of a bronchospasm and carries a syringe of epinephrine at all times. CL, a 16-year-old girl, sustained a ruptured liver when she hit a tree while sledding. Emergency surgery was needed to stop the internal bleeding, and during surgery, the ruptured segment of the liver was removed, and the laceration was sutured with a heavy, absorbable suture on a large, smooth needle. Before surgery, her hemoglobin was 10.2 grams per deal, but the reading decreased to 7.6 grams. Before hemostasis was attained, cell salvage or auto transfusion was set up. In this procedure, the free blood was suctioned from her abdomen and mixed with an anticoagulant, heparin. The RBCs were washed in a sterile centrifuge with NSS and transfused back to her through tubing fitted with a filter. She also received 6 units of homologous leukocyte-reduced whole blood, 5 units of fresh frozen plasma, and 2 units of platelets. During the surgery, the CRNA repeatedly tested her HGB and HCT as well as prothrombin time and partial thromboplastin time to monitor her clotting mechanisms. CL is B positive. Fortunately, there was enough B positive blood in the hospital blood bank for her surgery. The lab informed her surgeon that they had 2 units of B negative and 6 units of O negative blood, which she could have received safely if she needed more blood during the night. However, her hemoglobin level increased to 12 grams and she was stable during her recovery. She was monitored for DIC and pulmonary emboli. AY, a 52-year-old kindergarten teacher, had myelofibrosis that had been in remission for 25 years. She had seen her hematologist regularly and had a routine blood testing since the age of 27. After several weeks of fatigue, idiopathic joint and muscle aching, weakness, and frightening episode of syncope, she saw her hematologist for evaluation. Her hemoglobin was 9 grams and her hematocrit was 29%. 29%. Concerned that she was having an exacerbation, her doctor scheduled a bone marrow aspiration and the results were positive for myelofibrosis. AY went through a 6-month therapy regimen of iron supplements in the form of ferrous sulfate tablets and received weekly vitamin B12 injections. Interferon was given every other week in addition to erythropoiesis therapy, which was unsuccessful. She was treated for presumed aplastic anemia. During treatment, she developed splenomegaly, which compromised her abdominal organs and pulmonary function. She continued to lose weight and her hemoglobin dropped as low as 6 grams. Weekly transfusions of packed RBCs did not improve her hemoglobin or hematocrit. After a regimen of high-dose chemotherapy to shrink the fibers in her bone marrow and a splenectomy, AY received a stem cell transplant. The stem cells were obtained from blood donated by her brother, who was a perfect immunologic match. After a 6-month period of recovery in a protected environment required because of her immunocompromised state, AY returned home and has been free of disease symptoms for over 1 year. Number 1, the natural latex protein in latex gloves may act as an B allergen. Number 2, urticaria is commonly called C hives. Number 3, the cells involved in a T cell mediated allergic response are D, T lymphocytes. Number 4, anaphylaxis, a life-threatening physiological response, is an extreme form of B, hypersensitivity. Number 5, the common name for epinephrine is B, adrenaline. Number 6, the removal of part of the liver is called EANC, which is partial hepatectomy, and C, resection of the liver. Number 7, the unit measurement of hemoglobin means D, grams in 100 cc. Number 8, heparin, an anticoagulant, is a drug that D, interferes with blood clotting. Number 9, the RBCs were washed with NSS. This means the C, red blood cells, were washed with normal salt solution. Number 10, autotransfusions is transfusions of autologous blood, that is patient's own blood. Homologous blood is taken from A, another human. Number 11, patients who lose a significant amount of blood may lose clotting ability. Effective therapy in such cases would be replacement of C platelets. Number 12, CL's blood type is B positive. The best blood for her to receive is E, B positive. Number 13, myelofibrosis, like aplastic anemia, is a disease in which there is B, destruction of the bone marrow. Erythropoiesis is B, production of red cells. Number 15, the ferrous in ferrous sulfate represents C, iron. Number 16, hemoglobin and hematocrit values pertain to D, red blood cells. Number 17, splenomegaly is E, enlargement of the spleen. Number 18, the stem cells AY received were expected to develop into new B, bone marrow cells. Number 19, AY's health was compromised because the high-dose chemotherapy caused A, immunodeficiency. And then number 20, IG stands for immunoglobulin. 21, HGB stands for hemoglobin. HCT stands for hematocrit. Number 23, FFP stands for fresh frozen plasma. PT stands for prothrombin time. PTT stands for partial thromboplastin time. And DIC stands for disseminated intravascular coagulation.